Now on the reopening and what things are going to look like come Tuesday, because it's a big milestone in the pandemic. All these rules we've gotten so used to, 6 feet, masks, things can be a thing of a past if you're vaccinated.
Yeah, all going away. And to talk more about what is on tap for Tuesday when it gets here, we are joined tonight by Dr. Monica Gandhi with UCSF. Dr. Gandhi, thanks so much for spending time with us here on KRON 4 News at 9.
Thank you.
First off, what are the big things that folks need to be aware of when Tuesday at midnight, when it comes? Obviously, people are going to ditch their masks. Should they always have one available?
Yes, because I think business, like you just indicated, some businesses are not yet ready to not have indoor masking. I will say that the reason the CDC put this guidance into play is that the vaccines are extremely effective, both for the vaccinated individual and also preventing transmission to others after you're vaccinated. So they really meant it. It's a conservative organization, the CDC, but they really meant it in terms of feeling safe to unmask after vaccination, even against the variants.
So with these rules all changing, more people are vaccinated, won't have to wear masks in most indoor settings. What are the metrics that they're going to be looking at, the statistics and the data, to see how high COVID cases are going before maybe the CDC or the health department say, you know what, actually, we might need to take a couple steps back? Are we really ready for this?
So, you know, the CDC has actually indicated that we shouldn't be tracking asymptomatic infections after vaccination, because after you're vaccinated, the possibility of you getting a virus in your nose, you can still get it into your nose, but you actually fight it with your vaccine, and then your viral load is so low you can't transmit it. So though we are tracking asymptomatic cases after vaccination in California, that's not a CDC recommendation. What the CDC has recommended is that we track hospitalizations to confirm that they do not go up. We're at about over 100,000 in the state of California. That's the lowest risk level. And so when Governor Newsom announced in early April that we're going to open in June 15th, he said 2 things we need to track: the availability of our vaccine, which now we're done with shortages, and we definitely have plenty. And the second is track hospitalizations and confirm they're not going up with reopening.
So it's hospitalizations, the amount of people who are in the hospital, that's what they'll be looking at.
Over 100,000, and staying below 5 over 100,000, which we've been for weeks, even with the Delta variant, which is a blessing, and that is actually happening in the UK as well, because vaccines do work against these variants. So as long as we stay below those metrics, that's what the CDC has said, track from now on.
Dr. Gandhi, your colleague, Dr. Bob Wachter, went on a tweet storm this afternoon talking about basically a dire warning for the folks who have not received the vaccine yet. As more and more folks move into this new post-pandemic world, they are vaccinated. What are the concerns for the folks who have not yet received those vaccines? You touched on it a little bit with the Delta variant that is still prevalent in many parts of the country and the world.
Yes, so it's true that if you're an adult and you haven't received the vaccine, it would be better to get the vaccine. However, I do disagree with one premise of that thread, which is that there are people who have gotten infected and they still have residual immunity from natural infection. And that's why other places in the country that are opening up have a mixture of vaccine-induced and natural immunity, and they're not seeing these increases in cases, even with the Delta variant, even when they open up. However, I still think that getting at least 1 dose after you've had natural infection is prudent when we still have circulating virus, which I've publicly sort of put into a tweet as well. But I'm not worried about, for example, unvaccinated children or unvaccinated people getting more sick when we open up, again, because we have such high levels of immunity that keeps hospitalizations down. That's called population immunity. And I think we're there with 81% first dose here in San Francisco, 70% first dose across the state as of May 31st.
So coming up on Tuesday is also when the governor is going to be picking some people in this $1.5 million Vax for the Win lottery. So there's some cash incentives for people to get vaccinated. The A's we've talked about are giving away tickets to their games. Are these incentives working? Are vaccines for people going up?
They do work. And actually, this has been really known, at least in our field of HIV, that we give incentives, we give cards, we give money, and it works to take antiretroviral therapy. It works to take vaccines. Beer works, and so do huge lottery tickets. And you know, I think there's nothing wrong with this at all. The one thing that I would say about, again, just going back to this question of our unvaccinated children, the more and more adults we get vaccinated, that brings down case rates for everybody, and that makes sure that the children are safe.
All right, Dr. Monica Gandhi with UCSF. We always appreciate the time, the knowledge that you give us here on KRON 4 News. I'm sure you're looking forward to Tuesday as well.
I'm excited.
That smile said it all.
I know.
Thank you, doctor.
Join the club. Thank you, doctor.
Thank you.
You can stay up to date on the latest COVID-19 vaccine information along with the state's reopening on our website at kron4.com. Just use your smart device to scan the QR code there on your screen and be taken directly to the website.